Now, public health officials in the United States have been warning for weeks that a triple-demic could strain an already weary healthcare system. Hospitalizations from 3 viruses, that is COVID-19, flu and RSV, have been simultaneously rising. While officials say that RSV appears to have peaked, flu is peaking in a few parts of the country and COVID-19 infections continue to rise. The 7-day average of new daily COVID cases in the U.S. is now above 60,000. With over 40,000 hospitalizations, this is the highest that these numbers have been since September. Doctors have been treating patients with back-to-back respiratory illnesses, simultaneous infection with 3 or more viruses, or with bacterial infections. Otherwise healthy people who used to recover within days are now taking weeks with simple colds. So the popular word for the prevalent health situation in the U.S. is triple-demic. Why? It is because the U.S. is experiencing an unusually high uptick in both flu and respiratory viruses like the RSV infection, while COVID cases continue to linger. The spread of these 3 viruses has prompted the CDC to issue advisories. As of last week, nearly all 50 states were seeing a high or very high level of respiratory illnesses. The U.S. Center for Disease Control and Prevention warned that rates are likely to continue to increase. U.S. officials estimate that so far this season there have been at least 13 million cases of flu, 120,000 hospitalizations and about 7,300 deaths, including of 21 children. Now, doctors say the chaos has resulted in parents scrambling for antibiotics, shortages of basic essential medications such as fever reducers, and a barrage of questions and confusion about the interaction of different viruses in the bodies. Now, for more on this, our correspondent Susan Tehrani has sent us this report from New York.
Public health officials have been warning for weeks of a triple-demic consisting of COVID-19, the flu, and RSV, and how it will put a strain on an already weary healthcare system. Hospitalization of the 3 have been on the rise altogether. In the first week of December, regarding COVID-related deaths were higher than any time in recent months. Even with vaccine and treatments widely available, the CDC reported 3,000 COVID-related deaths. Case numbers are below those of earlier waves, according to the CDC, but about 14% of the U.S. population is in an area that meets the CDC criteria for being quote-unquote high regarding COVID community levels. New York City is currently one of those, as well as parts of Phoenix and Los Angeles in California. The White House has laid out a COVID prepared response plan, which includes free at-home test kits, as well as increasing vaccination sites and quote-unquote readying clinical personnel for deployment as needed to support jurisdictions. Susan Tehrani reporting from New York for WION World is One.